This is a software as a medical device for spine surgeons. It's called Pocket Instrument, and this is artificially intelligent. So the spine surgeons can use it as a pocket instrument. So it's called SpineGuru, and it works fully offline. Nothing leaves the device. The spine surgeon's pocket instrument is here. We have 6 deformity tools here: gap score, Cobb angle, pediatrics bracing, Lenke, correction planning, all in one page that runs on any phone, in any clinic, with or without the internet. See, there is no fees, no logins, and everything is on device. So this is three-dimensional spine. So what we have, let's see. This is the home. The home screen says what we have: Cobb goniometer, it's pediatrics, gap, Lenke classifier, correction planner, and Roussouly and references. So this is a prototype. So that was the home landing screen. Now let's see the tools. So we have spinopelvic parameters. We have pelvic incidence, pelvic tilt, sacral slope, lumbar lordosis, L4S1 lordosis, global tilt from C7 up to hips. Patient age, can just write. So the gap score, and let's see how we can load an example of a high risk case. So now it comes like this, the all parameters over here. So score is here, severely disproportionate. So all rates, and the summary: gap score 12 of 13, severely disproportionate construct. SRS, swap modifier, grade PILL, SUVA 92, PT 30. See now. Now we can look at the case summary also. So it gives the analysis. You can copy the report also. It does prediction. It does planning. So it said you can plan as in the high scoring gap component before finalizing the construct to low mechanical complication risk. So these were the references. So the final diagnosis and surgical decision rest within the treating surgeon. SpineGuru provides decision support only and is not a diagnostic device. Now that was gap adult. Let's see now the Cobb angle. Let's put the sample film. See here. So you can drag anywhere and measure the Cobb angle. It changes here. See. So now that was the sample film. So you can upload the X-ray also. So let's see if I can upload X-ray or not. So it's taking more time, and now it's looking at the desktop. Keys, my desktop. If I have some spine X-ray or not. Okay. Now I could not find an X-ray, but if you have X-ray, then you can upgrade, basically upload. So let's not waste time on here. So you can upload X-ray also like that. So we have a sample film. We just did it. It's a goniometer. Let's have more tools here. There's a case summary. It's 8 gap analysis. So home. Now Now more tools, like we have pediatric case also now. Curve age, like chronological age, pediatric. Let's load AIS bracing case now. Okay. So bracing case, this is how you can put it here. The full time till summary. Let's load infantile case. So in infantile idiopathic, okay, 0 to 3 years. So now, what could be the summary? So now pediatrics 28, infantile curve, pathway infantile, predictive analysis, curve progressive risk rises with large curve. See the reference. So planning, use the correction plan and Lenke. So many references. So if you need to know some things, and then you can go to a manual. So manual is how to use this, opening it anywhere offline. It works offline also. You can use it in the villages or anywhere. So keep it one tap away. You can just use it as an app in your phones, So the tool. So like we already said, it's working where resources are limited. It's very safe. It's a prototype. So it can get FDA approval or CE cleared. Also HIPAA compatible. Now let's go back to the tools. Let's see Lenke. We have curve profile, proximal thoracic, main thoracic, structural bending Cobb, kyphosis, PT, MT, TL, so psychiatrist mode. So lumbar modifier CSVL. So let's load one example, type 1 curve. So it's 1B, okay? So it's a Mesa MT, lumbar ABC positioning. So summary is Lenke 1B, main thoracic Mesa curve MTs. In this case, what does AI integrated SpineGuru says? It gives a summary. You can copy Lenke 1B. It does some prediction, so it helps you in planning. So this is it. So now let's go back to correction planner. How do you plan the correction? You have a pelvic incidence, estimate lordosis to restore for PI. Current lordosis 60 to 28. So let's plan target versus current. So let's load example of the flat back patient. Okay. So target 66 plus correction needed. 38 degrees of correction is needed. So current PI LN is 32. So 3-column osteotomy is more likely. So the apedical subtraction osteotomy PSO or 25-35 or vertebral column resection may be required. High magnitude correction. So summary is target lordosis 66, correction of 38 degrees, correct PI LL mismatch 32 degrees. So these are the things you can do with these things. This is in your hand. It's like a calculator. It's a very simple software as a medical device. No need to buy. So everything is safe. Let's see how it talks about that correction planner and load examples. So home tool, the manual. If you don't do anything, you can open. See, let's see the Roussouly and the reference. See the Roussouly. Morphotype, the sacral slope 48, pelvic incidence 55. Let's see the type 3. With loading the example, the reference target is by PI, PT, SS. The mismatch less than 10 degrees, the PILL mismatch, the sagittal vertebral axis, lumbar lordosis, thoracic kyphosis, and LDI. So the gap 0 to proportion, 3 to 6 moderate, more than 70 severely disproportionate. The reference from 2017, Gore et al. The type 3, let's load the example. K, sacral slope 35-45, preserve an angle curve during fusion. Summary: Type 3 morphotype SS 42 degrees PI 58. So what I would like to say is this is decision support only. This assists but does not replace the treating surgeon. The final click of the decision is upon the surgeon. So we have all these things, and now the case summary comes like that. It gives planning, predictive analysis. This is completely artificial intelligence tool in your hand, so spine surgeons can use it. The case summary comes like that. Let's go back to home. About this once more. So it has got 6 deformity tools, and about how safe it is, your data stays with you. Okay, so you can use it offline one more time. Let's go back and see the details. This is a prototype. The privacy is maintained. The roadmap is it's going to be automatic everywhere very soon. It's HIPAA and GDPR governed, so it has got license. So it has got copyright. So it's super safe. And why don't we try the spine surgeons?